How you doing, everybody? It's Dr. Dex Alvarez from Palma Chiropractic and Wellness Center, and I wanted to take a quick minute today and go over something that affects a lot of people who are especially sitting throughout the day, and it's something that's called a Piriformis syndrome. So if you're experiencing some lower back pain that can go down the leg, a lot of the time stops at the knee, but can go down into the calf or to the foot, you may have something that's called this Piriformis syndrome. And what it is the muscle that's located right above your glute can start to tense up. And it tenses up because that glute really isn't doing its job. And when that muscle tenses, your sciatic nerve, which is the nerve that kind of exits here on top of the hip and goes down the leg into the foot, it can clamp down on that nerve and it can give you that sciatica type pain. People start to look towards the lumbar spine and into that hip, but really what's going on is this muscle is tensing up on you, and that's what's creating this issue. So a quick and easy stretch to help that out. So if you're starting to feel this, you want to do this stretch seated. So I'm going to show you as if my left piriformis was really tight. What you're going to do is you'll sit. You want to try to get this leg as parallel with the floor as possible. And then the key to this stretch is arching your back, looking to the ceiling, and then bringing your chest down to your leg. So that's about as far as I can go before I start feeling that stretch. So when you're doing this stretch, the important thing is you don't want to overstretch this muscle either. So you're going to get to a point where you start to feel that tension. You're going to hold that for about 5 deep breaths or about 10 seconds. Then you're going to come up and relax, and you're going to repeat that 3 to 5 times. And this is something that can be done multiple times a day to start to release that muscle so that you can get relief in that pain that's going down the leg. Now be mindful, these muscles just don't tense up to tense up. A lot of times it's doing that to try to brace an issue that's going on underneath. So if you're having any of these pain sequences, while this stretch is really going to help you out, you always want to get in and get checked to make sure that there's not something happening underneath that is causing this muscle to spasm or go into hypertonicity that doesn't need to be corrected so that we can get it to calm down for good. So I hope this answers some questions. If you're dealing with any of this type of pain, make sure you get in and get checked, get the proper exam, the x-rays done so you know what's going on, and then you can go ahead and get this stretch in multiple times a day to help you out in the meantime. But hope you have a great rest of the day. We'll talk to you soon. Thanks.